Hello, everyone, and welcome to the webinar on Functional Approach to Health Interventions. Today's speaker, as many of you know, is Dr. Santucci. Dr. Santucci became a doctor at age 40 after undergoing a series of medical procedures and extensive rehab from a serious car accident. Because of his experience as a patient, he has developed a unique integrative approach with strong emphasis in getting the diagnosis right. He has attempted throughout his practice to establish the interrelationships between multiple organs and the body's mechanical systems clearly enough to produce the rapid and most lasting results. Dr. Santucci's pre-medical career included technical product management, working at high-tech companies including IBM and British Telecom in strategy and product development capacities. He brings this product innovation and business development perspective to healthcare. Dr. Santucci has a BSBA from Georgetown University in Finance and International Business Policy. Dr. Santucci studied functional medicine with the originators of the field, including Jeff Bland, Mark Hyman, and Dave Perlmutter. He completed the Achieving Clinical Excellence series with the Functional Medicine Institute and is a fellow in functional medicine with AAIM. When his son was diagnosed with a developmental delay, Dr. Santucci expanded to learning systems, studying over 1,000 hours of functional neurology training, with concentrations in functional neurology with Carrick Institute, as well as rehab of vestibular systems and childhood development delays. Currently, Clinical Director of Neurointegrative Care of Los Gatos and Advanced Regen Medical Inc. In the Silicon Valley, Dr. Santucci has 27 years of clinical experience with trauma and complex conditions addressing difficult-to-treat cases. We attempt to treat the condition in the state of health in which it occurs, including physical, biochemical, neurological, and energetic interventions. This clinical approach has included fast implementation of new technology to expand our clinical reach. We had originally worked with VNG and interactive metronome to address brain trauma and developmental disorders. We introduced PEMF to the Neurometabolic Board and are now working on expanding stem cell and regenerative solutions to our community. Dr. Santucci has taught advanced diagnostics and clinical interventions to medical doctors and their staff. Dr. Santucci has taught at the American Functional Neurology Institute, Health Centers of the Future Platinum Conference, Pulse PEMF Technology Conference, and the Applied Functional Medicine Institute's Technology Conference. Dr. Santucci is currently rewriting his first book, reporting 20 years of functional medicine called Constructing Medical Miracles, Return to Health Using Today's Technology. Without further ado, I will now pass the presentation to our speaker, Dr. Thomas Santucci.
I'm Dr. Santucci, and today we're going to be talking about functional medicine and a new approach to health interventions. I'm going to take this opportunity to go over our 2021 Shared Health Perspective series. We're going to start an educational series that basically goes through what's happening in today's medicine, going over the current research and important new breakthroughs, and then some old breakthroughs, kind of bringing up some stuff that shouldn't have been forgotten, looking at some of the medical controversies, the smoke and fire of what's going on today, and then pretty much go into a mentality system that we think will help most people. This isn't going to be either a salesy or a mercantile kind of thing, but we'll make you aware of what our monthly offers are on a tab on the side. So when we're looking at conventional medicine and functional medicine, unfortunately is a versus. It should have been that these are integrated things and that functional medicine kind of does the deeper cause and integrated medicine kind of does the acute care. But that's not what it's turned out to be. It's turned out to be an embedded system where we're really looking at the disease orientation and a pain orientation, and then one where we're trying to look at biochemical individuality. So when we look at this, functional medicine was developed in reaction to really patients coming forward and saying they weren't getting good enough answers. One of the things that's happened in the United States is a significant, severe overuse of medications and surgeries. When we compare our usage and really the levels and the amounts of surgeries that we do, it's 4 to 5 times what Japan does or what Germany does, both places that are well funded and have good medicine and good doctors. The diagnostic accuracy in conventional systems was rated at about 60% by Mayo Institute. So that meant that, the person that went to their primary care physician and was referred to the specialist and went through that whole procedure had a 40% chance that they were going to be working on something that the patient didn't even have. The symptom-based focus also was a problem. So we can cure the pain levels and not cure the underlying problem. One of the things that resulted in is a significant, kind of non-treating or non-handling of chronic conditions. So when a patient had the same condition for 10 years, it was classified usually as an idiopathic or, a disease that really couldn't be understood or cured, and that became the standard of practice. So in the 60s and throughout the 1900s and into this, the 21st century, there's been big problems with drug trials and clinical research in general. One of the things that I thought was true growing up in a medical family, that most medical procedures had some kind of research that, hopefully they were gold standard, placebo-controlled, double-blind, random samples. Well, that's not really true at all. So when we look at that, we think that the numbers somewhere in the 20 to 30% of medical procedures actually have research for what they're being used for. Most drugs are being used in an off-label use more than they're being used for what they were originally scheduled for. And then lastly is the lack of inclusionary politics. One of the things that the world just better get used to is that other kinds of doctors and other countries exist. So when we look at doctors in general, MDs are one kind of doctor, and they're really biochemists at the end of the day. They're doing drug therapy. Well, there's other kinds of doctors. Acupuncturists, in my opinion, are the best energy medicine doctor. That whole business of understanding the meridians and all the different power points that our body's energy goes to is exquisite. Chiropractors are holistic orthopedists. And again, what we did is we took one group and we sort of said, you guys own everything and you're allowed to do anything. And it's just not realistic. So when we look at, what's this in reaction to, you get to ask some pretty hard questions, like, has medicine taken the easy way out? So drug therapy basically has produced, the opioid epidemic and a whole class of people who think that things should be solved in 3 minutes without their involvement. Again, we do 5 times as many surgeries as Japan or Germany, but no better outcomes. And then one of the things that happen with doctors in general, and there's whole classes of idiopathic diseases where we just don't get a diagnosis. We've got a couple of big box stores near us, and it's just amazing, how many things they step aside rather than go deeper into the diagnosis. And then the reliance on the historical standards of care protections. What's happened in medicine in general, in the conventional world, is if everyone else is making the same mistake, you're okay. So we're looking at that and going, boy, if you had any other industry that was set up this way, they wouldn't be allowed to operate. And one of the things that's happened is that, insurance controlled and drug company sanctioned remedies are not serving the patient. And this isn't a competitive thing. This is what the people that are getting the care is saying. So the majority of practitioners today focus on alleviating symptoms. And this is a guy, Cade Archibald. He's an acupuncturist in Salt Lake City. Really, really smart guy, spectacular work that he's doing. He has 5 clinics. And he says the medicine of the future focuses on preventing disease before the symptoms affect our health. So he's an acupuncturist. He's got that holistic bent, but he's also an incredibly good biochemist. And, arguably, some of the best biochemists in the world are functional medicine doctors. So when we're looking at this, we're going to go in and say, what does this model look like? And kind of going in on a basic level, the tenets of functional medicine say that it's individualized patient-centered care. So patient-centered care means the patient actually gives you a big part of their answer. So they're obviously telling you about symptomatology. You're doing a review of systems based on what the patient is saying, but also they're part of their own answer. The diagnostic methodology dealing with the underlying cause of the illness is also part and parcel of this. And then a system of inquiry of the disease. When I first started, which was like 25 years ago, we were looking at antecedents, triggers, and modulators. So what went on before, what started this particular problem, and like what were the hormone kind of modulators. And that was really fancy. It was really kind of a good way of looking at it. We then looked at, what's the interrelationship of, the gut-associated lymphoid tissues to the Kupffer cells of the liver to the astroglia of the brain, and began to make statements about autoimmunity. So more and more and more, this research-based interrelated system began to develop systems that got way better diagnostics in chronic acute care than regular medicine was doing. And one of the things I want to emphasize here is that this always involved some kind of postdoctoral study. Nobody learned this stuff in med school. Nobody learned it in acupuncture school, in chiropractic school. So it's kind of sad, interesting, amusing when someone says, I went to a big name medical school and it was 20 years ago, and they haven't really learned anything since then. They are not going to know what functional medicine is. The other thing is that basically functional medicine sophistication has gone way, way, way far since when I first started it. So when they're looking at a problem, we're going to do, that beginning little matrix that I started, antecedents, triggers, and modulators, and we thought we were so fancy. And then we're going to go into mental, emotional, spiritual, and the psychosocial realm, and then combine it to all the other parts of a decision-making tree that could affect this person's problem. So this is an inclusionary functional medicine model at this point. So this isn't some chiropractor giving people some supplements. This is somebody really going in and saying, again, antecedents, triggers, and modulators, but then I'm going to do a review of systems. It's going to take every single contributing system into consideration. Now, in medical billing, you have to look at 9 different areas and say 2 things about 9 different areas. I've seen this done, and it's almost amazing how little information is possessed in that much write-up. So they write the encyclopedia, they say what's going on with the shortness of breath or the inability to urinate or the temperature changes or even the cardiovascular problems, but then they never get it to this is what's actually happening. It's not called for. Nobody's really asking for that. Well, this is called for this. So when we're looking at complex conditions, we say, okay, this is wrong, this is wrong, this is wrong, the interrelationship's here, and you intervene this way. So it's kind of an art form. So it's not just, I've got the skills to do a decent neurometabolic examination and I have enough information in my diagnostic, armamentarium to kind of classify that, but I'm also going to intervene in the place that is most appropriate. And so this is where there's a huge difference from conventional medicine. These days, you can kind of map the kind of care a person's going to get by the letters after the doctor's name. You can't do that in functional medicine. In functional medicine, the doctor doesn't know what you need until he does the analysis. And very importantly, every single person is individual. So even in a clinic like ours, where we're doing regenerative medicine and lots of times stem cells are the answer, we're dealing with people that are prior, Olympic athletes, and we're dealing with people who have inhaled asbestos for the last 20 years. Those are different people, even though they both might get a 2 cc IV push. So when we're looking at this, functional medicine deals with interrelated systems and complex conditions in a number of different matrices. Kind of the storybook level is, so you'd look at, inflammation, remember that's a primary indicator of things. You'd look at the neurology, you'd look at cardiac stuff, obviously look at hormones, bioenergetics, and detoxification. So when we look at this is in an autistic spectrum disorder functional medicine clinic. So they're looking at, what's going on with immune dysregulation, chronic inflammatory responses, metabolic dysfunction, oxidative stress, gut disease, and toxins in order to understand behavior. So this is a pretty, interesting and in this case very effective grouping of a lot of details that makes these guys really professional in what they do. This is the interrelationship of autoimmune targets. This is something I put together about 10 years ago. And one of the things that was interesting to us that we were dealing with a lot of thyroid patients because the neuroendocrinology stuff just wasn't diagnosed very well. And so we were looking at we were doing brainwave brain maps on these people and looking at the alpha, theta, beta brainwave changes. And we would see the people who had the thyroid problems also had the brain problem. That caused us to look deeper and say, oh, if you actually look at thyroid, it's not just TSH being produced by pituitary hypothalamus going to the thyroid, but that whole cascade is literally a brain-initiated cascade after it's reading the system. And true, the thyroid can be off, but it's pretty rare in the United States. But it's much more that the thyroid or the brain is being attacked by the autoimmune system. And so once we had a kind of a working theory that was an autoimmune disease, we began to address the underlying triggers of autoimmunity. So, and again, some people have heard me do this, but that's the food antigens, which is gluten, dairy, egg, yeast, soy, metals, hormones, stress, trauma, pesticides, poisons, throughout the whole thing. Pregnancy is a major progenitor of this kind of activity. So a lot of third trimester of birth, women were getting really, a thyroid disease. It looked like postpartum depression, but it wasn't. It was a neuroendocrine thyroid problem. So when we went into the triggers, we could address this. So because we understood that the brain was actually responsible in many of these cases, we were really getting good outcomes by doing neurofeedback on people with thyroid problems. No chemistry at all, because we understood that was the possibility of an underlying cause. When we're looking at things like peripheral neuropathy now, the diabetic neuropathy is it most of the time. There's a blood sugar problem, so therefore the nerves are not, they don't have the fuel and activation that it takes for proper operation. But when we're looking at that, the underlying cause on this is a blood glucose problem. So the diabetes, we've got to get the hemoglobin A1C, the glucose, and the triglycerides under control. Well, most of those people, even though they've got a diagnosis of diabetic neuropathy, have been told they can't do anything about it. When we start looking at these triggers, these are all actionable. So in our clinic, it made a huge amount of difference to have kind of a underlying interrelated system model to help people understand that these are causal relationships and that you don't have to live with it. In almost no situation do you have to live with a complex condition. And again, this is a big kind of mindset change for a lot of people. A lot of people in the post-Korea, Vietnam, do what the doctor says kind of mentality, don't really understand that, there's better things and better ways to look at it. So going into this a little deeper, when we test in a case like this, when we're looking at a person with an autoimmune imbalance, which is going to create every disease on this page, when we're looking at that, 90% of the time we're doing their blood work that is producing answers that their blood work didn't produce before because no one really put it together. We're looking at toxins, we're looking at gluten, we're looking at heavy metals, brain neurotransmitters, hormones, metabolic changes. Again, other groups are looking at these kind of things, but they're just not putting it together in a way that actually produces anything. One of the very first things that functional medicine doctors do when they're looking at your blood chemistry analysis, that you want to compare the blood chemistry to the lab ranges. And something I didn't know until I was a doctor was, actually until I was 10 years into being a doctor as a functional medicine doctor, was that the lab ranges are not some universally accepted healthy range. They're the average, the metabolic mean of the people that went to the lab that you went to. So LA has a different range than San Francisco, has a different range than Silicon Valley. And none of those are predictive of healthy outcomes. So one of the things that functional medicine did is it really, really did a good job of saying that here are target levels. So, again, I'm going to use TSH and thyroid as an example. It used to be the medical functional levels were 0.5 to 5.5. When we actually did the real work on that, we narrowed it to like 1.9 to 3. So basically 2 to 3 is healthy. All these people on the side are not healthy. So imagine it's 20 years ago, you're a female and you've got complete loss of energy after your second child, and they tell you it's all in your head. And there's a lot of that. There's a lot of, if I can't figure it out, it must be the patient's fault. Now, I'm all for taking responsibility for what is our fault and what isn't our fault, but a lot of these things are normal consequences of autoimmune disease. And so, again, we're looking for autoimmune concomitants in a lot of these chronic acute issues. Even with regenerative medicine, where we know that we've got, stem cells that can balance out immune function, if we can get that underlying cause, we're going to get a lot of headway on the thing. So this is a good example of an interrelated system, and this is why you don't want to super specialize. So this was a detailed presentation that I did to a bunch of doctors, but so sort of bear with me on the techno babble here. But chronic intestinal inflammation suppresses brain function and actually creation of brain cells. So the hippocampus is a part of the brain that controls the vagus, which goes to every single organ in your body, function. So the decreased pro-inflammatory cytokines, which are chemical messengers, stop the DNA to RNA performance, limiting the proliferation of basically new brain cells. So now your gut biome, which is being credited for everything from food cravings to, the color of your eyes, influencing everything, is now directly related to how many brain cells you're making in a super important part of your brain. So you can't say I'm a neurologist and I don't go past the spinal cord, because now the gut is affecting the brain. You can't say, I'm a podiatrist and I'm not going to go past the ankle, which is really kind of tough because half the things in the foot are controlled by a leg. You have to look at things from a systems point of view. And again, in any other industry but medicine, people would be falling asleep saying all this was just normal. Well, in medicine, the super specialization has enabled people to look at 3 inches of the human body and be content with that. So it sort of begs the question, what if we did everything we know how to do? So this is one of the things that I do when I'm being given a really hard case. We're looking to the past. Has somebody figured out something in the past that was a good idea to do? So we don't want to throw out the baby with the bathwater, especially in metabolic things and some cancer things. There, some of the good stuff is 50 years old. Gerson therapy in cancer, where they're doing the juicing twice a day. Gerson juice like 8 times a day. So we found out that wasn't really necessary. But they're juicing a couple times a day, and they're doing coffee enemas, which sounds terrible, but it methylates the portal vein, which comes down from the liver and surrounds the colon. So, and then methylation is a very good thing, I believe, in fighting cancer. So you have these 2 things that are backup that are there. Now, we would also combine every medical discipline we could get our hands on if it was a life and death kind of a thing. There are times to, if we're talking about cancer, there's times to debulk a cancer. That's certainly appropriate. There's actually times to do any of the different therapies. But combining the therapies always gets you a better answer. And in this country, that means dealing with different kind of doctors. I personally would use international solutions. It's obvious to me, especially on the rehab side, that other countries are ahead of us. When we had a couple of patients, including me, who had reflex sympathetic dystrophy, we looked at the Japanese resetting of the sympathetic nervous system using Kiatsu, which is like a computerized tourniquet thing, and got that. Pulse electromagnetics, while produced in the United States, the new generators are domestic. That technology is from Eastern Europe. We would look everywhere. And then when we're looking at powerful new technologies, we're talking about being early adopters. And this is not a dig on any particular group, but there is obviously a group of people that's kind of entrenched that is not really going to change what they do. There's another group that is fast adopters, and there's another group that's going to totally break all the rules. So when you're looking at this, you want a fast adopter, but you want a safe practitioner. What's happened in the United States is the standard of medical practice is not considering new technology. It goes very, very, very slow. So if you look at what is being accepted, what there's a CPT code or what the FDA is approving, it's very slow compared to what other countries are doing and compared to what's available. And so one of my points here is an inclusive medical approach would greatly increase the efficacy and really opening the system to not only non-standard solutions, but also to the appropriate practitioner. If MDs are totally overwhelmed, then we should be using acupuncturists, nurse practitioners, chiropractors as the first doctor, as the screening doctor. In some cases, they're going to get the diagnosis better than the classically trained conventional doctor. So what does an all-out effort really look like? And a long time ago, I was like, okay, what are the different aspects? What are the different arrays that a person could look at in medicine? And what are the different types of doctors? And so we did this physical, biochemical, neuro, and energetic framework. And that stuck. So I've had that for about 10 years. So when we're looking at very complex conditions, we're going to look at it from that kind of perspective. I gave a presentation on Alzheimer's intervention to the ACIM, the American Academy of Integrative Medicine, a couple of years ago. And we were introducing the idea of using stem cells for basically brain inflammation. So as most of you know that, Alzheimer's is the creation of a amyloid beta plaque in the brain. So it's like a cholesterol deposit, but it's not, it's different, in the brain. And then the actual protein of the nerves, the tau proteins, would get disturbed and destroyed. And that ended up being, it looked like an autoimmune process. So we treated it as an autoimmune process. All the time, remember, you're not allowed to treat these things. You're just treating the patient with it, so it's an important distinction. So we did intranasal stem cells because it's the most powerful thing, in my opinion, to actually stop brain inflammation. And remember, the Time magazine article on inflammation is the primary cause of almost all chronic conditions. All the oncology, all the cardiology, all the arthritis starts with inflammation. You get inflammation under control, you're going to do a lot of good. In those days, we were doing neurofeedback for brainwave entrainment. So we were actually doing brain scans and the neurofeedback that allowed us to trace and to really track the brain changes. And that was very, very, very positive. Then we looked at all the biochemistry. And so when we especially looked at neurotransmitters, we looked at autoimmune triggers, we looked at inflammation, and usually the diet and activities, we got a long ways. Pulse electromagnetics is one of those therapies that I particularly think is good for almost anything with a mitochondrial problem. So this is a generalized shutdown. So all the dementias we're using pulse electromagnetics for, but this is just our recipe. This is like making soup. You could go to 2 or 3 very good functional medicine clinics and they would have their own soup. So that's one of the best and the worst things about this, because there's not a standard of practice per se. There's an approach, and usually it's based on what that person's education and really involvements are. The last thing that we're doing is looking at vestibular rehab, which is really balance training. What we learned is, the cerebellum, the pontine cerebellum area of your brain is responsible for smooth coordinated motion. So if I put my finger to my nose, that's mitigating the signal a couple hundred times. But we also know in the advanced neurology that it's responsible for really smooth emotions. So physical things are now neuropsychological things, and some of those distinctions are blurring between the cause and effect of these things. So that's our kind of a rundown of what From the Kitchen Sink is. When we're looking at functional medicine, a good source to see, what's out there is the Institute for Functional Medicine. This is probably, arguably, the soul stone of functional medicine. They have quite a few doctors. Most people that are functional medicine doctors are MDs, but they kind of cross over the line. And so again, the tenet of functional medicine, so let's suppose you're a classically trained person, you're going to understand that biochemistry, but you're probably going to do more tests, and your interventions are going to be way, way, way more deeper. So I like the Functional Medicine Institute. There's a few training groups for those of you that are coaches or just very, very interested. And, Functional Medicine University is one. They have like a 1-year program. It's pretty good. I did 10 years of study with the Functional Medicine Institute. And I was always kind of astounded at the new stuff. Like I would go there and in a weekend, I would learn more than I learned in a year in other things, and I could implement them on Monday. So the people that have dedicated themselves to this kind of work are really amazing. And what are they? They are amazing biochemists. This is really a biochemical world. There's also functional neurology. So functional neurology kind of revolutionized chiropractic. So chiropractic was pretty holistic, and it's like you do the adjustment and nature takes over, and there's lots of, putting it in God's hands, which is great. What happened with the new neurology after they understand the relationship of 105 neural pathways and really some beginning of the interlobular and the Broca's area level brain function is that they could come in and change, myelination of destroyed nerve pathways. It was huge. So now all of a sudden you can bring people out of comas. Now all of a sudden you can do something about brain inflammation. When we match the functional medicine with the functional neurology, we begin to get a synergy that starts creating, what look like miracles. So about 8 years ago, I wrote my first book on engineering medical miracles. It's about that. Where we're going right now is we're adding regenerative medicine. So if we're looking at regenerative medicine in a functional medicine outline, regenerative medicine has the qualities of decreasing inflammation, balancing out autoimmunity, self-replicating and repairing tissue, and probably having a positive impact on DNA. So it's pretty amazing. It's another one of those, the Berlin Wall just came down. So there's lots of people that do regenerative medicine who kind of give homage to functional medicine. But if you've been to 2 weekend seminars and you can say the words, it doesn't mean you can do it. So one of the things about regenerative medicine is that everybody's in that field. In my opinion, the very best people in regenerative medicine are holistic functional medicine doctors. And they are kind of evenly distributed from acupuncturists. And acupuncturists are really good at it. They're just great with needles, and it's a needle kind of a thing. Functional chiropractors, chiropractic neurologists, own a lot of regenerative clinics. And the reason they do is they understand the body healing itself. Some of the best people in regenerative medicine are so-called complementary and alternative carriers. And I wouldn't want to leave out that, there is no question that some of the anesthesiologists and some of the orthopedic MDs who really know the inside of the body are great at this, but they're not better at it than the chiropractors are, and they're not better at it than the acupuncturists are. So there's no ownership in this because you can get to it from a lot of different ways. When you're looking at functional medicine, however, that takes 5 or 10 years of training. So again, there's people who have that, and this is a group of people that can kind of get you in charge or in touch with that. So when we're looking at functional medicine as an overview, it's a model of individualized, patient-centered, science-based approach that empowers patients and practitioners to work together to address the underlying causes of disease. This is a key point. One of the reasons it takes longer to do a write-up and really the diagnostic paradigm is you need the patient to participate with you. There's a part the doctor does. In our case, there's a part that stem cells do. And there's a part that the patient does. If we get a person off of gluten and dairy, if they're positive on antibodies for those things, we're going to get a way better answer. So it requires a detailed understanding of each patient's genetic, biochemical, lifestyle factors, and leverages that data to direct personalized treatment plans that improve patient outcomes. One of the things that I think I've been really happy with in my relatively long career is that I never treated a normal person. I always treated, either the hard to diagnose or the exceptional or the very, very, very sick and dying. And every one of them had a part of their presentation that was just stellar. Like they had a great attitude, or they were really strong, or they could do things with their intention that was just fantastic. And every one of them had a system that was failing in their own unique way. And so the idea of biochemical individuality speaks to me a lot. When I was going through my own medical challenges, I was told more than a dozen times, one, I was lucky to be alive, but also that people with, a 2,900 liver enzyme count are dead. And I wasn't dead. And I would look at it and I would go, I must have something else that's compensating for it, or my general package is able to recover, from a liver problem faster than that, after surgeries. So when we address the root cause, rather than put people in boxes that they don't really fit, and we become oriented to doing the detective work. Being a functional medicine doctor means you're a detective. I don't know what's wrong with a person until I do their consult and their examination. It's not, even in simple things like peripheral neuropathy or simple things like a knee problem, I don't really know what's wrong until I examine them. And we don't do the same thing with any two people. Well, no functional medicine doctors really do. When we're doing testing, it's always individual. So again, when we're looking at targeting specific manifestations of disease for each individual, it means you have to do something that really takes the individual into account. So I hope this has been useful. I get that, this is a distinction that not a lot of people understand. And it's important now because as we go into the new medicine, it matters whether you've got a person who's used to spending 4 minutes with the patient and writing a prescription, or whether you've got a person that can actually look at, your problem and deal with you as an individual. In functional medicine, you get much more of a vote, because there's an important part that you play, and there's a kind of a prima facie assumption that we're not just rushing toward drugs to mask symptoms or surgeries because your insurance will pay for it. So when you're really looking at the, what's the doctor do, and he's really a coach, what does the medicine or the interventions and the therapies do, and then what do you do? And, one of our cliches is there's two kinds of people that don't get well. The people that want to do everything by themselves and kind of think they've got control of that'll get you in trouble. And the people that don't want to do anything themselves. And, we get it with stem cells all the time. Well, the stem cells cure my diabetes. And we're like, yeah, right after you control your blood sugar. And so without being facetious, there's always a part that is a teamwork part, which means that you've got to have an exam and a consultation that go into a functional medicine level of detail. So I hope that helps. Again, we're going to try to do this once a week. With the Christmas, we're going to start in January. If you have specific things that you'd like me to talk on, that's possible. And what I'm going to do is kind of look at what are the big issues for 2021 and try to address some of that. I'm doing an analysis right now on some of the interventions we're doing for the large-scale viruses, and one of the things that I see when people again have extreme positions on things like COVID, they usually have one side of the story, and doctors are supposed to be scientists. So one of the things that I'm going to do is try to present both sides of the immunization story, both sides of what we're actually doing and what's a reasonable outcome, and then maybe where to get information you can count on. So appreciate you watching. Send us any comments you have, and I think you can click to the side and look what's going on with our clinic right now. Thanks again.